Welcome, everybody, to the Injury Prevention Plus Safe Environment for Every Kid, or SEEK program, Wave 7 Education Series, SEEK 102 webinar. We have appreciated everybody's interest in this education series. So this is the second webinar of two for Wave 7. And it's bittersweet that this is kind of the last touch point for SEEK that is on the calendar for now. We'll see about future funding, but this is kind of where the SEEK program ends currently, and we're happy to have your interest currently and historically. Disclaimer, the views and opinions expressed are those of the authors and do not necessarily represent the official policy or position of the Ohio Department of Health, or ODH. And reminders for the group: to obtain continuing medical education, or CME, credit for this presentation. We made it a two-step process, including the completion of the Wave 7 SEEK and Injury Prevention Program survey. If you have done that already as part of your SEEK 101 follow-up, you don't have to do it again. You can claim credit when it's posted online, but if you want to complete it because you learned something new or you want to have another conversation, we're happy to do that. An evaluation link will be emailed to you after the presentation, and upon completion of the online evaluation survey, you'll receive an email with your PDF certificate and access to print the certificate. This presentation is approved for 1 total hour based upon full participation, and presentation materials and resources will also be available after. Disclosure, the presenters have considered the Ohio AAP Speaker Toolkit standards in preparing for this presentation. It is their intent to foster respect, belonging, support, and accountability. If you have any concerns or comments, you can contact Dr. Logan. And throughout this process, we have always wanted to thank, and we continue to be grateful for, our program partner, the Ohio Department of Health, the Violence and Injury Prevention Section, or VIPS. So some of you know who we are from before, but those who are new to SEEK and the Injury Prevention Program here, the last 3 waves has been, I have been the program manager for those. I am Brooke Powell. Last webinar, you heard from Dr. Jody Wells. She is a SEEK and Pediatric Injury Equity Content Expert. And then today we will be hearing from Dr. Lendrum, SEEK Content Expert. And Liz Lendrum, MD, is an assistant professor of emergency medicine at the University of Cincinnati and a pediatric emergency medicine physician at Cincinnati Children's Hospital Medical Center. Her interests include pediatric trauma, child safety, and improving care systems that support children and families. She has served as a content expert for the injury prevention and SEEK implementation for the past 3 years. And objectives for today's webinar: we will review implementation outcomes from the SEEK Quality Improvement Initiative, identify strategies that support SEEK sustainability, describe practical approaches to electronic health record integration, and apply workflow lessons to your own clinical setting. Dr. Lendrum.
Thank you so much, Brooke, and welcome everyone. So as Brooke mentioned, we will be talking about some lessons learned, some EHR integration, and then practical strategies for long-term implementation. Next slide. I have no financial disclosures or conflicts of interest, and again, we're supported by the Ohio AAP, and funding is through the ODH. Next slide. How we are going to start is reviewing some of the data from our last wave. So you guys can see, some of the things that have come from our SEEK wave and what you guys can expect and some of the goals that your practice can be working towards. Next slide. So last year, in terms of some of our outcomes, we had 14 participating clinics in our SEEK wave. Specifically 1,600 or 1,609 caregivers were screened and completed the screener. There were 100 or 1,200 families that received resources from this program, and then screening rates overall increased to greater than 99%. And then this is what that graph shows. It shows the the start of the seek wave and where screening rates are and where they were at the very end of the year. Some of the additional findings, we saw that counseling rates improved across all of our domains that we asked questions to families about, and questions asked and answer rates improved significantly. We had 92% of caregivers who reported willingness to implement a behavioral change based on this survey and the resources and counseling that they received. Next slide. So in terms of some of the domains that we addressed, and that you all will address, these include family needs, car seat safety, safe sleep, social needs, and home safety. And some of the key findings from this particular slide, we had provider counselor rates that ranged from 70% to 89% when a risk was identified. Family needs counseling increased from 45% to 89%, and home safety needs were usually identified most frequently, and counseling for home safety improved from 51% to 77%. So this graph just shows that our counseling and resource provision improved across all of our different risk domains that we studied as well. Next slide. Another tool that, or another measurement that we looked at was specifically providers' confidence and efficiency with using the survey materials and the resources. And specifically, we found that standardized workflows improve both the provider comfort and operational efficiency. So provider confidence increased during this time with our surveys and resources. Injury prevention confidence, so specifically counseling on injury prevention, increased as well. And then all providers that completed our exit survey after our program plan to sustain these changes. Specifically, they felt they had improved efficiency with identifying these risks, more consistent caregiver discussions in their places of work, and better integration into their clinical workflow. Next slide. Does anyone have any questions about this before we move forward to sustainability? Okay, next slide. So to talk a little bit about sustainability, next slide. We found that one of the biggest lessons from this initiative was that sustainability really depended far more on the workflow design than on individual motivation. So the sites that were most successful embedded screening seek into their processes as clinicians who were already in what they were already doing rather than creating entirely separate workflows. A few themes that consistently emerged. So first, minimizing additional documentation burden was critical. Second, standardization helped create reliability across providers and staff. And then third, local champions were extremely helpful in maintaining engagement and troubleshooting barriers early on. So things like social work in your practice can be super helpful. And then finally, having a clear pathway for resources and referrals made the process feel actionable rather than just another screening task. Next slide. So one of the most important operational strategies was integrating Seek directly into the EHR. The highest performing sites generally added Seek questions into existing documentation templates rather than creating standalone forms or separate workflows. This reduced clicks, minimized duplicate documentation, and helped normalize screening as part of routine pediatric care. So when possible, sites also use discrete data fields, which improve tracking and reporting capabilities. Another key factor was aligning the workflow with existing responsibilities. So, for example, determining which portions were completed by the nursing staff versus providers versus social work, making sure that the process was standardized across the board. Next slide. So when thinking about implementation, simplicity consistently mattered more than sophistication. So most sites followed a fairly similar process. So first, identifying where screening naturally fit into existing workflows, then integrating questions into current templates, and followed by developing documentation tools and referral pathways. And then importantly, the most successful implementation started relatively simple and then refined the process over time rather than trying to build a perfect system from the beginning. Automation also helped reduce variability. So whether through smart phrases, auto-populated documentation, or standardized referral workflows as well. Next slide. One provider said, I think the major takeaway from this work is that sustainable seek implementation is achieved when screening becomes part of routine care rather than additional tasks layered on top of the workflow. So I think this is, one big thing that was really important that we found, and integrating screening into existing systems, prioritizing operational simplicity, and standardizing processes all help improve reliability and then long-term adoption. We saw that implementation translated into meaningful action with improved counseling rates, increased resource provision, and then strong caregiver willingness to make behavioral changes. Overall, these findings suggest that a sustainable or a substantial potential for long-term impact when Seek is operationalized into a practical and sustainable way. Next slide. Are there any questions regarding sustainability that I can help answer? Okay. Thank you. And then I will let Brooke take it over to talk a little bit about some of the survey results.
Thank you, Dr. Lundrum. We do have a good mix on the call today, previous SEEK participants and new to kind of the SEEK work and maybe future work. So I don't want to put anybody on the spot, but we may quote you here. We pulled from the surveys, but I might also ask you to start thinking about if you would like to share some of what you are doing around SEEK and SEEK sustainability. I know most of you who participated in the past are still continuing at least a few questions into your template. So start thinking about that. I might cue you later. But these are the SEEK sustainability results. These next slides show you the true impact via the data and via the providers and the staff and boots on the ground that did the program in the past and that have sustained this work and how beneficial they have found it. So the question was, to ensure changes made during the SEEK program are sustained. These are answers from the practices. We have social worker that follows up with all the abnormal social drivers of social determinant of health screens. They use the handout with all the various links, which now we have a toolkit that houses all of those links, so that is still up for use. And we have rebuilt our EMR AVS to include a lot more safety and age-appropriate education as well. Parents are grateful for any help that they can get. Often they feel overwhelmed and frustrated and do not know what to do. There's also limited time, right, for you in the office and for families as they come in. And they really appreciate any guidance and resources that can be given. I think that has been a common sentiment from the interviews that I have had so far and what continues and what is sustained from SEEK the most. And then the families are so appreciative that you guys care about them. And if you don't ask, they will admit the critical information that they would never know and why they were missing the information in the first place. So the survey results continue, and the question was, since your participation in the SEEK program, what changes have continued to be sustained? We provided a list of actions that we had during the QI program itself, and we asked everybody to choose whichever ones were still appropriate for their sustainability plan. So most providers are continuing to provide resources or handouts. They continue to encourage caregivers to use resources of areas of need, continue to screen for injury risks. Without the full screening tool available, the last wave of QI used an iPad. So this encouraged work without the iPad. So pulling in questions that they felt would be most impactful into their template and into their kind of screening questions for age-appropriate screenings. Continue to screen for social determinant risks, again, without the full screening tool, picking and choosing what were the most impactful questions. Continue having discussions about injury prevention risks and continuing to have discussions about social determinants of health. So here's some images and graphics for your data results. So did the SEEK program change the way you address injury prevention and or social determinants of health with other patient populations? Overwhelmingly, the answer was yes. We have always talked about spread, getting the SEEK program in front of the older school age children or adolescents. And this speaks to the potential for continuing that work and spreading it through additional age groups and not just the young kids. Do you plan to continue to sustain any changes made as a result of the program? Again, yes, by a lot. I think that marker says almost 96%. And we know that time is precious, and we know that not all of the topics and questions can be sustained or can be built into your template. But someone throughout this program who answered this survey certainly took away some of the questions to implement after they continued or finished the program. How often do you use the changes made in your practice? So daily is the overwhelming answer here, followed by weekly and then monthly. Monthly could encapsulate a training or any new hires that need more information, but I was impressed to see that daily was over 70% of the answers here. So it is important work done frequently. And do you feel the changes made as a result of the SEEK program have helped you improve efficiency related to social determinants of health risks? And overwhelmingly, yes, over 80% feel that an improvement was made because of the program. And do you feel changes made as a result of the program have helped you improve your efficiency in injury and safety risks? And over 90%, almost 100%, have answered yes to this. This speaks to what questions were being asked before the program started. So more safety and injury questions were being asked by providers kind of in baseline and before they started the program. And then they were able to add in more injury prevention questions and safety questions. And then the additional social determinants of health questions on the hybrid questionnaire. So I think that speaks to kind of the increase here. And did the SEEK program change the way you address injury prevention and or SDOH in other patient populations? Again, they have an eye on the spread that we've always talked about. Almost 80% are focused on this for the older age group. That was a lot for the data, but any questions on that? This may be an okay time to ask the providers who are willing to speak to maybe their experience of the SEEK program and what sustainability takeaways they would like to share with the group who hasn't maybe had a chance to incorporate SEEK into their practice yet. Okay, if you think about it, please let me know. Okay, resources. So as a reminder, we covered this in the first webinar, and then Dr. Lundrum reminded us of what the topics and subtopics were earlier. But here's another review of those who were covered in the SEEK waves previously. So car seat safety and safe sleep up to 12 months. Those are the two kind of safety issues that were being asked by providers before the program started. And then we added and encouraged questions around home safety, including burns, choking, drowning, and falls, CPR and first aid, firearm safety, marijuana safety, poison control, securing furniture, securing medications, smoke and carbon monoxide alarms, and the smoking in the home. And family needs include alcohol and substance abuse, domestic violence, maternal depression, parental stress, and parenting skills. And then social needs was encompassed by childcare resources, food insecurity, housing resources, and job resources. So everything that we had previously on what we called the SEEK resource page is now housed in a public facing. It's not secure. You don't need a login or a password. Everything is now included in the SEEK toolkit. It still has the content for providers, staff, families, and caregivers. And here is the link and the QR code right here. You will get these slides. You will get access to the toolkit after the webinar. And specifically for sustainability, at the bottom of the toolkit, we have currently four sustainability resources that are available to you. So those include information on data and sustainability, planning, implementation, performance, or PIP sustainability tips. That is from the Ohio chapter internal team of experts. The Quality Improvement or QI Corner Intro to Sustainability slide deck and information there. And then sustainability in QI, redefining value. That is also a very valuable slide deck. Kind of once you get your feet wet with QI and what the sustainability pieces look like, that will take you the next step. And even if you aren't going through the whole program, you are just kind of going to pull into your template what questions you feel that are appropriate. You can still get value from the quality improvement resources that are listed here. So the SEEK webinars, there has been SEEK 101 and this is SEEK 102. The recordings and slides are available for review on the SEEK toolkit. The SEEK 101 webinar highlights include, some of you were on that, some of you are going to review it, but introduce the SEEK model and its purpose in practice. Review the core concept of the SEEK model for both new and returning participants. Highlight available resources to support participants and their staff implementation. On the first webinar, we went into detail on each section and what is available on the SEEK toolkit. We kept it higher level today because you can go back and review that, but you can also click through the SEEK toolkit in real time and you can review that and see what is appropriate for training for your team. Okay. Before we get to next steps, I want to, Dr. Lender, I want to have you give me a heads up or a thumbs up if you can see and hear what I'm trying to share, please. Okay, I'm glad that came through. So I jumped into that one, but it gave you a little bit of a hook. But this is one of our favorite sections on the SEEK toolkit. I encourage you to explore it when you get to the link. But these are the SEEK safety topic videos. I believe they were created in Wave 4. And we took topics that are covered by the SEEK program, and we had help with creating these little vignette videos to animate and illustrate in a maybe different, not pencil and paper way to families. And I think it's worth going through these just to kind of highlight the toolkit here. So this next one is Eating Healthy on a Budget, SNAP and WIC.
Let's talk eating healthy on a budget. Start by dividing the amount of money you set aside each month to buy food by 4 to get your weekly grocery budget. Next, make a list. Check out the Ohio AAP website and myplate.gov for meal planning resources and shopping list templates. Don't forget to browse weekly ads and coupons. Many healthy choices may be eligible for SNAP or WIC benefits. Take your list with you and stick to it. Remember, you are not alone. Help is available. You can find even more resources and links to information on programs like WIC and SNAP on the Seek Resources page at ohioaap.org/seekresources.
So just as a reminder, the Seek Resources page has now become the toolkit, but all of the resources have been transferred over. This is a video on keeping kids safe at home falls. Taking a different approach with parental mental health. Childcare resources.
Looking for childcare resources? Check out ohioaap.org/seek resources. Follow the link for jfs.ohio.gov under Childcare Resources. Click the JFS link and select Menu, then Childcare for information on available childcare in Ohio, how to get help paying for childcare, types of childcare, and additional resources. To search for childcare options, visit childcaresearch.ohio.gov. Select your county, and your desired program type. Then add any additional filters. Here I'm selecting Monday, Wednesday, and Friday at a childcare center that offers meals. Click Search for a list of childcare options that matches your preferences. As you search, check out Step Up to Quality, the system that rates childcare programs across Ohio. Star-rated programs exceed minimum licensing requirements to ensure quality care for your child. Scan the QR code to learn more. And check your child care search results for stars. For more resources, go to ohioaap.org/seek resources.
Next is Narcan. Last but not least, CPR.
To find a class, visit redcross.org/take-a-class. Select CPR and enter your city. Choose online or in person and click Sign Me Up.
So throughout all the waves of Seek, the most marked question by families, therefore the most need identified, was the CPR question. So we felt strongly about making a video about CPR. Can anyone speak to having reviewed these videos or used them with your families and had a good outcome you would like to share? Okay, we're back to next steps. So we are asking all providers, if you have not done so already, as part of this webinar series and education series, to fill out the survey. We are gathering information on your current practices, sustainability, and you, through the survey, get an opportunity to participate in a short and sweet interview with me for a tangible resource incentive. It's just kind of an extension of the survey questions and the education here, but we want to learn what you're doing, if you have implemented anything, or if you have any questions about implementing it. And I've talked to some of you who do God's work every day. You may go into the home of the patients, you see the need firsthand. So I've appreciated those conversations about adding the Seek kind of protocol to your current protocol and the questions there, and the identifying the gaps and the opportunity to learn more and train your staff too. The interview is information gathering. The chapter wants to learn more about you, and so does ODH. Again, about what you're currently doing or what you plan to do. And then review of Wave 7 Injury Prevention and Seek program survey answers will happen in the interview. And then we'll go over in more detail the Seek toolkit and the resources that are available. I had one interview that it was eye-opening that so many resources were available. Some they were familiar with, and some they could see kind of training the team and using them going forward. And then you can ask a Q&A to me about implementing or sustaining Seek within your practice. And then anything Q&A related about Seek. If you have taken the webinars and you have additional questions, the interview is the time to get those answered. Okay. There are some new people who have joined the call. There are some new people to Seek. There are some people that have been in several waves or maybe one wave. Any discussion points or questions for us? You have an expert in Dr. Lundrum on the call. She's been part of 3 waves. I have been part of 3 waves as well. So anything that could help you get started or continue your sustainability plan. Dr. Lundrum, can you please share the hot off the press news about the Seek poster and how we will be spreading our education in the fall?
Yeah, sure. So in the fall in October, we will be presenting some of those results actually that you saw from our last wave at the National AAP Conference in San Diego via poster presentation, which is very exciting.
Was there Seek Education presented at any other conferences across time?
Yeah, 2 years ago now, I believe, we also presented at the National AAP Conference and focused on one of the waves where we looked a lot at the motivation to change by caregivers following our resources and counseling.
Thank you. Not to put you on the spot once again, but do you have, having gone through the waves kind of together, do you have any advice for practices? You maybe were newer to the content, but now you know more. What is a good takeaway for sustainability or implementation for practices to hear?
Yeah, I would say there's a lot of great resources to take advantage of, especially through our website that we just shared. So definitely utilize those because I think that it makes your job a whole lot easier and gives families really valuable resources to take good care of their children.
Yeah, you heard the quotes from the sustainability survey. That was a text box, and providers have shared kind of in person when we asked them the question, but then also in the survey. So only positive things have come out of this program. We can't talk about injury prevention enough. I'll pause again for any questions that anybody has for Dr. Lundrum or to post to the group. Okay. Just as a reminder, this slide was also, the content was earlier as well, but to obtain CME credit for this presentation, we're asking everybody to fill out the survey at least once, even if you attended both webinars. I would love for you to mark yes for the interview. I think people that have gone through the interviews would say it was pretty painless, but we would appreciate hearing more from you, having a brief conversation about what you currently do. I'm learning about different roles in this space across the state, and that has been very impactful. But you will get a follow-up email and access to your certificate upon completion, which is now. So thank you again for your completion of this and for your interest in SEEK. Last opportunity to ask questions for us. It's a quiet group. I will be your contact for anything SEEK related, so please don't hesitate to send an email from the follow-up email that I sent to you or anything that you review online. We're happy to answer questions even after Wave 7 wraps up. So thank you again for your interest and have a great week.
Thank you.